That was Dr. Ali Hamdullah on national health insurance. America adopted a form of national health insurance, popularly known as Obamacare, in 2014. With us now is our city reporter, Nicolet Hartman, who is from America and interning with us. We'll be chatting about what national healthcare insurance looks like in practice in the States. Hi, Nikki.
Hi, Lanina.
Thanks for joining us.
Of course.
So, Nikki, you guys have national health insurance in the States. Tell us can you explain how that looks and what it means for you guys?
Yeah, so basically, everybody that works pays a tax. It comes out of our weekly paycheck, and it's our Medicaid, Medicare. And the Affordable Health Care Act is also known as Obamacare. We all pay for it, so it's mainly going for the wealthy, and the elderly are getting the benefits of it, or the poor and the elderly are getting the benefits. So the younger people and the older people get a little frustrated because they feel like they're the ones that are paying for people that are using it when they're not using it as much. But it kind of works full circle if you let it work itself out, because as you get injured or you get older and you're going to be using it more often, it ends up working out very well.
So let's just backtrack a while. So it's basically a form of medical aid, but everybody has access to it.
Yes.
Not just people who can afford it.
No. So before Obamacare came into act, there were less than 20 million uninsured people that were living without health care that now are having it.
Okay. And so you've got a unique experience because you broke your foot.
Yes.
And you accessed healthcare, public healthcare before Obamacare, and then you broke your nose after Obamacare was implemented.
Yes.
And so can you tell us the difference or how those two experiences were?
Yeah, so I'm very accident prone, and when I broke my foot, I went to the public hospital and simply just got 2 x-rays and crutches and a little wrap on my foot, and it was well over $5,000. And
at a public hospital?
At a public hospital. I was just a waitress, so that was clearly way too much money. I couldn't possibly afford it. I had to end up moving back in with my parents because it was unreasonable to expect a 20-year-old to pay for that. Then after getting health insurance, I broke my nose. I had already met my premiums for that year just by regular doctor appointments and checkups, and I hardly had to pay anything. My surgery was pretty much free. My doctor appointments, I just had a $30 copay. It was an incredibly different. I was able to live my life without worrying that I was going to go bankrupt. So it's absolutely worth it.
Okay.
For me.
Yes,
I'm not an expert.
And so this is the way it's supposed to work for everyone, right?
Yes.
And is it compulsory to have this insurance?
You do have to have health insurance. If you don't have health insurance, then when it comes time to do your taxes, there is a fee that you have to pay. But it is because if you don't have health insurance, you get hurt. The way that our universal health care works is that despite having a pre-existing condition, whether it's cancer, also being a woman is a pre-existing condition, so you have to pay higher. But despite anything like that, you can still get health care. So if you're hurt, you get the insurance, and then you cancel it right after you get hurt, you're kind of just taking advantage of the system and you're abusing it. So that's why it's a small fee that you do have to pay. So everyone does have to have health insurance.
Okay, and where does this leave, I mean, in the States, of course, because we can't say that it's going to be exactly the same in South Africa, but where does this leave private healthcare companies?
So it actually works out quite well. If you enjoy your private health insurance, you're allowed to keep it. You don't have to have the Obamacare. You can keep your own insurance. This is just an affordable option that is available to people that can't afford private health insurance.
Okay. And so there's one contentious issue, though, you mentioned it earlier up front, is that people who are working are basically paying for it, and people who are not working, like elderly, those who are retired, are accessing it, and they feel that it's unfair.
Yes.
Okay. Are the premiums very high, or the taxes, rather?
Right now it is higher, but it's only been around in full force for about 3 years now. It's by no means a perfect system, but it's something that has to work out its kinks. So we have seen a drop in a lot of major cities in the high premiums. So it's a messed up system that's working out in time. If you look at countries like Canada or France or Japan, it works very well.
Thank you so much, Nikki. That was looking at national healthcare insurance and what it looks like in practice in the United States. That's all we have for today. We hope you enjoyed the show and have a good, warm evening at home. I'm Linda Rasul. Good night.